Hello students, welcome to Concept of Care for Patients with Muskuloskeletal Trauma, Part 4. We're going to start with carpal tunnel syndrome. It's a common condition in which the median nerve in the wrists becomes compressed, causing pain and numbness. So let's watch this video to understand better carpal tunnel syndrome. Here we go. Okay.
This is the pathway that creates a problem.
And this is basically the carpal tunnel ligament. The median nerve is this yellow structure.
Carpal tunnel syndrome is simply pressure on that nerve. A majority of the times, doctors don't know why, but sometimes it can be due to a mass or thickening of the tissues in the carpal canal.
And patients will generally complain of numbness and tingling. It mainly happens at nighttime.
Orthopedic surgeon Dr. Sanj Kakar says if symptoms are ignored, carpal tunnel can lead to difficulties doing what were routine tasks.
Women have difficulty doing their bra. Men have difficulty doing the top button on their shirt.
Dr. Kakar says for some patients, wearing a wrist brace at night can ease symptoms. A steroid injection may help, although the effects can wear off over time. The next option is a short surgery to open the tunnel and relieve the pressure.
All we're doing is literally opening up this band. The actual procedure takes 5 to 10 minutes. And it's amazing the number of times you see patients who say, I didn't realize that's all it took.
For the Mayo Clinic News Network, I'm Jeff Olson.
Thank you so much. Wow, that was a very quick and nice video. And usually we are selecting videos that are not more than 4 minutes. Most of them are between 1 and 2 minutes, so you can have the full lecture in the video. Okay, so carpal tunnel syndrome is the most common type of repetitive stress injury, and these are the fastest growing type of occupational injury. Usually present as a chronic problem. Acute cases are rare. Excessive hand exercise, edema, or hemorrhage into the carpal tunnel or thrombosis of the median artery can lead to acute carpal tunnel syndrome. Is also common complication of certain metabolic and connective tissue diseases, for example, in rheumatoid arthritis patients and diabetic mellitus patients. So carpal tunnel syndrome in women, especially those older than 50 years, are much more likely than men to experience carpal tunnel syndrome, probably due to the higher prevalence of diseases such as rheumatoid arthritis in women. Well, I've seen patients in their 30s having carpal tunnel because of their job, right? Sometimes they are all day typing in front of the computer, or they are working in hotels, cleaning the rooms, or maybe they are working in a restaurant, so they are doing the preparation of foods and vegetables. So it could be in any age. Remember, this is the repetitive stress injury. Okay, this is a repetitive stress injury. Health promotions, disease preventions, basically ergonomics. Ergonomic is the study of how equipment and furniture can be arranged so that people can do work or other activities more efficiently and comfortably without injury. So in this sense, the U.S. federal and state legislation has been passed to ensure that all businesses, including healthcare organizations, hello nurses, pay attention, provide ergonomically appropriate workstations for their employees, Occupational Safety and Health Administration, OSHA, and the Joint Commission also requires that hospital and other HCO healthcare organizations provide a safe work environment for all staff. So basically it's ergonomics. Recognize cues assessment based on the patient history and report of hand pain and numbness, and without further assessment, you can basically make a diagnosis of carpal tunnel syndrome. Patient typically report a pins and needle sensation in the first three fingers and nocturnal burning pain that is relieved by activity upon waking. Strenuous hand activity can exacerbate the pain and numbness. So there is a test here. I think I mentioned this in class, the fallen test. I want you to watch the videos, especially for other students that are following my channel from other schools.
Phelan's test is used to help diagnose compression of the median nerve, also known as carpal tunnel syndrome. The purpose of the test is to reproduce symptoms by impingement of the nerve. The patient pushes the palms of their hands together and holds the position of 1 minute. If numbness, tingling, or pins and needles is felt, then the test is positive. The test can be repeated, but this time the patient pushes the backs of their hands together and holds. Again, the test is positive if symptoms are reproduced.
Thank you so much. So that's the fallen test for carpal tunnel syndrome. Okay, let's continue. Best practice for patient safety and quality care, health promotion activities to prevent carpal tunnel syndrome. Attention, attention. Become familiar with federal and state law regarding workplace requirement to prevent repetitive stress injury. When using equipment or computer workstation that can contribute to developing carpal tunnel syndrome, I'm going to refer from now on as CTS. Assess that they are ergonomically appropriate, including specially designed wrist rest devices, geometrically designed computer keyboards, chair height that allows good posture. And this is very important, nurses, because you don't want to take care of a patient and later you're going to have an injury. Okay, excuse me, let me get a sip of water. Okay, thank you. So in addition to inspecting for muscle atrophy and task performance, observe the wrist swelling, skin discoloration, nail changes, and increase or decrease hand sweating. Okay. Non-surgical management, aggressive drug therapy, and immobilization of the wrist are the major components of non-surgical management. You can use NSAIDs. Probably if the problem is more severe, they can inject corticosteroids. A spleen or hand brace may be used to immobilize the wrist during the day, during the night, or both. But most of the cases that I've seen are they usually recover mobility, good mobility, without pain, with NSAIDs and the splint. That's it. And they use the splint overnight. Surgical management. During surgery, the transverse carpal ligament is resected to relieve pressure on the median nerve. Remember that the median nerve is affecting the first three fingers of the hand. One of three procedures may be used: endoscopic carpal tunnel reduction, mini open carpal tunnel reduction, and ultrasound guided carpal tunnel resection. Okay, so after surgery, monitor vital signs and check the dressing carefully for drainage and tightness. The surgeon may require that the patient affected hand and arm be elevated above the heart, like with the other procedures in this chapter, for several days to reduce postoperative swelling. Check the neurovascular status as usual. Offer pain medication. Discomfort should not last more than 24 to 72 hours, meaning 3 days. Hand movement, including lifting heavy objects, may be restricted for 4 to 6 weeks after surgery, and that's common sense, right? Let's go to review the concept related to knee injuries, okay? In addition to the bone and muscle problems already discussed, trauma can cause cartilage, ligament, and tendon injury. Many musculoskeletal injuries are the result of playing sports, professional and recreational, or doing other strenuous activities, physical activities. A tendon rupture in a knee is cared for in the same manner as a tendon rupture in the wrist. It's tendons. So the care is similar. So the best practice for patient safety and quality care, emergency care for patients with sport-related injuries. Do not move the victim until a spinal cord injury is ascertained. For assessment of a spinal cord injury, use RISE, and you're going to see how many times, at the end of this chapter, we're going to see how many times and how valuable is RISE, the RISE method: rest, ice, compression, elevation, right? Always assume that the area is fractured until x-rays studies are done and assess neurovascular status. Okay, so here you have a knee immobilizer. Because the knee is most often injured, it is discussed as a typical example of neuromusculoskeletal trauma. Is the typical example. Trauma to the knee results in internal derangement, a broad term for disturbances of an injured knee joint. When surgery is required to resolve the problem, most surgeons prefer to perform the procedure through an arthroscope when possible. Postoperative care for knee surgeries generally include analgesics, physical therapy, and bracing or splinting, often using a knee immobilizer, as we see in this picture 44.11, right? But we need to check the skin often. All patients require frequent neurovascular monitoring. Rehabilitation services may be needed. Okay, so let's go to rotator cuff injury. Let's watch this video. Rotator cuff injury. This is getting very common. Okay.
The shoulder or glenohumeral joint is stabilized by a group of muscles called the rotator cuff. These are the supraspinatus, infraspinatus, subscapularis, and teres minor. They arise from the scapula and merge to form the rotator cuff tendon, which is inserted into the greater and lesser tubercles of the humerus. Their tendons hold the head of the humerus in place in the concave glenoid fossa of the scapula. The muscles and their tendon work together to reinforce strength in all directions of the shoulder and arm, and allow for movements like raising your hands, jumping jacks, and even giving hugs. Supraspinatus abducts the humerus. Infraspinatus and teres minor externally rotate the humerus, while subscapularis internally rotates it. The most commonly injured of these is the supraspinatus muscle. The tendons are susceptible to tears, impingement, and inflammation. When damage occurs to the muscle, it cannot effectively stabilize the shoulder. A patient would usually present with pain and weakness of the joint. In a clinic, this can be diagnosed by a positive painful arc test, the drop arm test, and weakness in external rotation, and radiologically with x-rays, musculoskeletal ultrasounds, and MRIs. Rotator cuff tears can be managed by physical therapy, steroid injections, topical agents, massage, and acupuncture. But if the trauma is severe, then surgical treatment is required. Fortunately, this treatment is minimally invasive and can be done arthroscopically with small incisions, fine instruments, and cameras. This procedure is often done as an outpatient procedure, which does not require hospital stay.
Excellent. Thank you. So that was the rotator cuff injury. Okay. So the primary healthcare provider usually treats the patient with partial thickness tears conservatively with NSAIDs, intermittent steroid injections, physical therapy, and activity limitation while the tear heals. Physical therapy treatments may include ultrasound, electrical stimulation, ice, and heat. And I've seen patients with rotator cuff only going to physical therapy without any ultrasound or electrical stimulation, blah, 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 only using ice and heat and NSAIDs with great recovery, depending on the physical therapist. For patients who do not respond to conservative treatment in 3 to 6 months, or for those who have a complete full thickness tear, the surgeon repairs the cuff using mini open or arthroscopic procedure. As we saw in the video, after surgery, the affected arm is usually immobilized for several weeks. Pendulum exercises are started on the third or fourth postoperative day and progress to active exercises in about 2 weeks. Patients then begin rehabilitation in the ambulatory care occupational therapy department. Teach them that they may not have full function for several months. And we have another NCLEX question, right? The nurse is assessing a client who injured the left knee while playing football with friends. Which of the following nursing actions are appropriate for this acute injury? Elevate the affected leg to decrease swelling. That's good. Recommend that the client get an x-ray, of course. Apply an elastic sleeve or wrap on the affected knee. Rest as much as possible so that the knee can be healed. So all these answers are in your electronic version of the book. If you go to the student resources and then you select a chapter of your preference and then you click on answer key, you can find these answers there with the rationales. Examples of acute soft tissue musculoskeletal injury: you have the sprain, strain, ligament tear, meniscus, tendon rupture, patellofemoral pale syndrome. I told you this chapter was really long, but is covering everything related to musculoskeletal. So it's a great guide for you. And we prepare these recordings in the way that you just put the recording and let the video play with all the videos included, explaining different concepts. So also, let me go to the mastery questions section. A client who had an elective left above the knee amputation 2 days ago reports severe pain of 9 on a 0 to 10 pain intensity scale in the left foot. Oh my God. What would be the nurse's most appropriate action at this time? So A, administer the analgesic medication that is ordered for pain. Okay, you are not going to tell the patient that the amputation was performed, so you are not going to question the patient, why are you having this pain, right? Next question. The nurse is planning care for a client who has a new compound fracture of the left wrist. For what complication would the nurse determine the client is most at risk? For a compound fracture is infection. 3. The nurse is assessing a client who sustained a right tibia fibula closed fracture with a large amount of soft tissue injury. For which of the following common complications would the nurse carefully monitor? Select all that apply. So you're going to monitor for infection and acute compartment syndrome. And all these concepts, we review it in detail with videos also. So I explain it, I read it, I played videos for you to understand. Okay, guys. So we have concluded the segment of musculoskeletal in this semester. Thank you for your attention, and we are going to continue with the gastrointestinal.